Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hello, everybody. Welcome back. Welcome back. You're listening to Living Pain-Free, the educational program. I'm Dr. Thomas Grove, board-certified physician, sports medicine fellowship trained, and we're talking all things sports medicine, orthopedics, and our favorite tool in the toolbox, which is regenerative medicine, okay? If you guys haven't heard about this, you got to get with the times, right? Surgery's getting out, right? Now we can actually start to promote healing of soft tissue injuries, whether you're suffering maybe from some arthritis, maybe a ligament, tendon, joint injury. These are things that a lot of times now we can address with a simple set of injections. Okay, basically what we do is we take the body's healing cells, things like platelets, things like stem cells we can get from the bone marrow, very powerful healing tools that we have at our disposal. We take those cells, we concentrate them down, and we deliver them with image guidance. Okay, we use something called musculoskeletal ultrasound. It's like a live video. I can actually watch that needle going all the way in to these spots. We want to help promote some healing. Okay, the idea is we want to promote healing of soft tissue injuries, keep you out of that operating room, increase the function, increase that structural integrity of where that damaged tissue is, and hopefully get you back in business. Okay, we want to give you guys a chance to talk to us live here in the studio. Maybe you're a loved one suffering from some pain. You want to know what's going on. What are the other options that are out there? Again, this is Living Pain-Free. I'm Dr. Thomas Grove. The number to call live in the studio, we're at 866-870-5752. That's 866-870-5752. If you give us a shout for a limited time, we're going to send you a copy of our book absolutely free, even pay the postage for you. Title of that book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And if you're ready for a free consultation over the phone with our staff, that number to call is 800-300-9300. That's 800-300-9300. And a fantastic resource for you guys to check out, absolutely free, hundreds of pages of good content there. Educate yourself on what's going on with your body, anatomy, regenerative medicine. Check out some studies about regenerative medicine, some videos of us doing these procedures. Check out our website. We're at www.stemcellinstitute.com. That's www.stemcellinstitute.com. Most importantly, spot on every page for you guys to get in touch with us via email. We're a very high touch point clinic, right? Anytime that you're a patient of ours, we want to make sure that we're keeping in contact with you. Again, we give our cell phones out to all of our patients, making sure we're keeping those lines of communication open. And if you're not a patient, right, make sure you get in touch with us, right? We have a great staff, great team to help field calls and texts and phone calls and all these sort of ways you can get in touch with us. Make sure you're taking advantage of that. A lot of folks just, they're a little too scared to make that first step. So we want to make sure we're giving you all those sort of options, whether you're calling in the radio show, texting, calling, emailing, making sure that you guys know that, we're here for you. Okay. So in our next series here, we're going to be talking about a very, very common problem that we see in the clinic, and that is hip pain. Okay. Now, hip pain, as I was prepping this talk, I'm like, man, there's so many ways you can go with this thing. Hip is a pretty small sort of area there, but there's a lot of stuff around it. Okay. So hip pain to one person might not mean hip pain to somebody else. Just a kind of brief sort of intro of the topic here. With the hip, right, could be coming from the buttocks and the backside, could be coming from maybe the back, right, that lower back area, could be coming from maybe the abdomen, could be coming from maybe the front side of the hip, maybe some quadriceps. So there's a lot of structures that people confuse with the actual hip joint itself. Very commonly, people come in, they say, oh, there's something wrong with my hip, and it's actually outside of the hip joint, close to it, but not the hip joint. So I want to go through some of those common sort of topics here today, see if any of these resonate with you. So getting back to, again, some basic anatomy here of what the hip is, okay? Ball and socket joint, much like the shoulder, okay? Remember, it connects that pelvic girdle, right, to the lower limb or the leg, okay? So there's a lot of force that goes through that. It has a lot to do with stability, a lot of the weight-bearing sort of movements that we do. Again, very, very important that if we have a problem with that sort of area, we try to get it taken care of, right? If you get a problem with a weight-bearing joint, your ability to exercise and live a good, healthy life likely is going to be very limited, okay? So this is one of those really important areas that we want to make sure that we can keep in good shape, okay? We want to keep you moving, keep you exercising, right? Whatever sport is that you like to play, whether it's your daily walks, right? Hitting the gym. The hip is a very, very important area for that. And we're talking about a little bit more about the anatomy here. Remember, the ball and cup there, okay? There's a lot of structures right around that, okay? Now, the thigh bone called the femur, okay? The ball of that femur, all right, which is kind of the ball and cup there. Again, that's called the head, okay? The head of the femur, and it meets the cup side, which is on the pelvis, okay? We call that the acetabulum. Okay, some fancy terms there for the ball and cup joint, all right? Now that little depression, okay, that cup, all right? It's kind of on the lower sort of outside aspect of the pelvis, right? Remember, we got one on each side. And, in that little deep pocket, right, there's like this little collar, this little rim of tissue, okay? It's pretty tough. It's made of something called fibrocartilage, all right? And that's called the labrum. Okay, so I'm sure you guys have heard of labrum tears in the shoulder. We have something very similar in the hip. It's a really strong piece of tissue. Remember when I was doing a lot of my anatomy courses, teaching in medical schools, doing advanced injection techniques, and you actually get to put your hands on a cadaver, put your hands in that labrum. It's a really tough piece of tissue that has a lot to do with stability of that hip joint. The hip joint's really, really hard to dislocate. Compared to other things like fingers and shoulders, things like that. So typically it's a pretty, large sort of mechanism of injury, a lot of forces involved to pop that hip out. And that's because the thing's so dang stable, right? We got a nice strong labrum keeping that ball up into the cup. Very common area of pathology that we'll talk about here later. But what we're talking about, the ball and cup, remember they glide over one another, right, with something called articular cartilage. Okay, now when that cartilage starts to wear out, right, when that whole covering of that joint called the capsule starts to get inflamed, again, this is more of a chronic sort of inflammatory process. That's what we call osteoarthritis. That's certainly something that we see, especially as we get a little older, a little more wear and tear. Maybe you had a trauma, maybe you have some sort of autoimmune conditions like rheumatoid arthritis or psoriatic arthritis. There's a lot of different, causes of that. Most of the time that what we see is, more wear and tear sort of arthritis there. And again, what we're looking at in terms of the muscles around that entire area, right? Again, I encourage you guys to, look this stuff up with me. It's kind of fun to look at your own anatomy together. If we look kind of on that front side of the hip, I see a lot of issues here that, again, can cause a lot of pain, right? And it's very confusing because you might think, man, it's like it's right in my hip. It must be my hip joint. And maybe go ahead and get your x-ray or MRI. Maybe it shows that there's nothing wrong with you, right? That kind of makes you feel a little crazy. You're like, man, I have all this pain. Doc says my hip joint's feeling pretty good. A good chance could be just maybe a muscle issue, right? Remember, where a muscle attaches the bone, right? We call that the tendon, okay? The tendon portion of a muscle. And the connection of the bone itself, we call that the enthesis, okay? So across that hip joint, because it translates so much force, right? We got a lot of muscles to help with that sort of process. On the front side here, some of our hip flexor muscles, right? I'm sure you guys have heard of those before. Iliacus is a big one, right? The psoas, that's another big one. If we're looking at the muscles that are kind of on the inner aspect of that thigh, right, the groin region, we've got a couple adductor muscles, okay? So that's something that can cause a lot of pain for folks. I remember back in my football days playing as a linebacker for the University of Nebraska. I had a couple adductor strains myself, and it kind of freaks you out, right? It's up next to the groin, right? You're like, oh my gosh, is this the hip? Is there something wrong with the groin? That's a very common area, especially in our athletic population, or maybe someone has maybe a slip and a fall. Maybe they have a little strain of their adductor muscles. That's a very common thing that we see. I treat a couple of those typically a week. Another really common one too, on the front side that crosses that joint right there, are some of our quadricep muscles. Okay, remember some of those quads help us with some hip flexion, also some knee extension like you're kicking a soccer ball. That's a really common one that we see, right? Rectus femoris, that's a big one. And then you got your vastus lateralis, vastus medialis, vastus intermedius, right? These are all really common sort of muscles that can have little strains. Sometimes we'll find tears in these sort of muscles as well. And, if you're doing like an x-ray, you're not going to see that, right? Remember, x-rays are great for bones, okay? You have a joint that's dislocated, you've got a big cancerous growth, you have a big fracture through a bone. Yeah, x-ray should be able to pick that up. But in terms of the soft tissue, right? Muscles, ligaments, tendons, right? Joint capsules, labrum, these sort of things. Remember, the x-ray is not really the imaging use of choice there. Again, what we love to use is going to be something called musculoskeletal ultrasound. Okay, remember, higher definition than MRI. This technology is so dang good today. Remember, it's a live video that we're doing in the clinic, and I'm the one who's doing it. So we can actually look together on the screen. We can look at your anatomy together in real time. Especially for a hip, because it's such a complicated sort of area of anatomy. We want to make sure that, as we're moving that tissue around, we can get a lot more information with what we call a dynamic ultrasound scan. Okay, so what that means is I can actually move that body part around, put some tension on it, right? Have you activate muscles if we need to. And I'm looking at a live video on the screen where we can look at that tissue together. Okay, so especially for things maybe like a labrum tear, maybe you have a loose body in the joint, maybe we've got a little strain or a tear in a muscle. A lot of times if I dynamically move you around, right, we can get a lot more information compared to a static image. Remember, a static image is where you're sitting completely still, right? That's like when you're getting your x-ray, your CT, your MRI. So remember, the dynamic nature of that musculoskeletal ultrasound is very, very valuable when we're trying to put together our proper care plan. Okay, very, very important that we're looking at a good, proper hands-on physical exam when determining where someone's source of their pain or their symptoms are. Okay, very, very important that we're doing that. We combine that with a good dynamic diagnostic ultrasound scan, putting those pieces of information together, right? Listening to your patient, right? A lot of times they're going to tell you what the story is and give you a nice clue as to, in terms of, where their pain's coming from. So we put all those pieces of information together. It's like a puzzle, right? We're fitting it together. And from there, we can figure out what's going on. And if we can address it with regenerative medicine, right? It's a little more conservative. That can be a fantastic option for you. Sometimes people certainly do need surgery, but a lot of times we find that's just not necessary. We can do a simple set of injections and promote some healing of that tissue, and many times that's something that can help get rid of your symptoms. So that's a fun one there. If we're looking at other muscles as well, this is a really common area. If we look kind of more on the lateral or the outside of that hip, there's like a big nub, so you guys can actually feel it together. If you got your phone or your tablet out, look up this body part. Okay, it's called the greater trochanter. Okay, trochanter, trochanter. This is a really, really common source of pain for folks. We typically see a little bit more of this than actual hip joint pathology. This is something that is just incredibly, incredibly common as we get older, that we might have a little strain, maybe a little inflammation of one of these little tendons that attaches to this bony prominence. Okay, that little lump on the side of that thigh bone called the greater trochanter, a lot of little muscles attached there or attached right next to it. So again, I can rattle off a couple of these muscles here, right? Some of our gluteus muscles, okay, those buttock muscles attach over there, right? Gluteus minimus, gluteus medius, right? Remember, the glute max is more on the back side, but it can certainly, mimic some of these sort of painful symptoms. Another common one's called the piriformis, right? I'm sure you guys have heard of that one before. It runs right through the middle of that buttock, attaches right on there on that greater trochanter. A couple other ones, right? These are fun ones. Obturator internus, that's a good one there. Gemellus, right? You got a superior and inferior, right? That's a really fun muscle there as well. Very commonly overlooked. Another one, too, is the obturator externus. So, again, the reason I'm bringing all these sort of anatomic structures up with you guys is just to understand there's a lot of muscles that attach right around that hip joint. Okay, so it's very, very important that, if we get maybe an MRI or an X-ray or a CT result and they're saying maybe there's something going on with the hip joint, but if that's not the cause of your pain, and maybe it's one of the muscles around the joint, we don't want to be chasing that. Okay, very, very common that we're going to find, pathology or something wrong on that radiology report with our hip joint, especially as we get older. And that can be very confusing, okay? Just because maybe you have a labrum tear, just because maybe you have some osteoarthritis of the hip, does not mean that's exactly where your pain is coming from, okay? So that's a good segue into one of my favorite studies. And again, if you guys can follow along with me here, I'll give you the title, the journal, And encourage you, to check out these studies that we talk about here on the radio program, that we can kind of educate yourself and kind of open your eyes up. Okay, when we're looking at the decision to have a surgery for these sort of issues, remember many times this is something that's an elective procedure. Okay, remember an emergent procedure is like, hey, you get your bones sticking out, massive fracture, you got in a big car accident, we got to have an intervention now, otherwise you may pass away. That's like you're in the trauma bay, right? You're in the emergency room. Which I spent many years in my training, and making sure that we're getting good foundational education there. And so certainly, those are things that maybe you need some surgery right there on the spot. Okay, but what we're talking about is this sort of elective space, meaning it's your choice as the patient if you want to have a medical intervention. Okay, remember we all have our own biases in life, right? Mine in medicine is to be very conservative. Okay, if we need to have a surgery, yeah, absolutely. Those can be life-saving sort of operations. When we're talking about the elective surgery space, especially in orthopedics, right? Sports medicine, musculoskeletal medicine, we want to be a little more conservative when we can. All right. The big reason for that is when we're looking at surgeries, we also have to look at, what are the complication rates? All right. We have to make sure we're looking at, what's the actual risk that we have undergoing a procedure like that. Remember, anytime we have any sort of exposure to general anesthesia, right, it's where they kind of put you to sleep, right, for any sort of procedure, there's a risk you might not wake up. Okay. Granted, it's a small risk, but that's a risk that's on the table. Maybe you have brain fog, right? A lot of times these anesthetic molecules, they're, fat soluble, so they linger around in your body for months and months. A lot of folks have, just some brain fog or maybe some general sort of fatigue afterwards. It just doesn't make you feel great. So that's another big reason to try to avoid any sort of procedure like that. Anytime you open the skin up, right, cutting the skin, big infection risk there, okay? Anytime we're going in with maybe a scope, okay, called an endoscope. If we put it into a joint, called an arthroscope, all right? When we're piercing the covering of a joint, called the capsule, remember that capsule provides a lot of stability to a joint. So whether it's your knee, your shoulder, your hip, your toe, right? All these joints have capsules to them. It's like a firm kind of balloon right there, right? That's where that joint fluid lives. When we have any sort of piercing of that capsule, when we're putting a scope in or we're cutting and opening up that joint, we immediately have a more unstable joint. Okay, when joints have more instability, things just wear out faster. Okay, and we're talking about wear and tear, right? That's kind of your osteoarthritis picture. Okay, so that can cause a lot of pain. And eventually, right, when that arthritis gets bad enough, total end stage, total bone on bone, this is where, regenerative medicine has a little bit more of a limited sort of effect. That's where, surgery might be the only option for you at that point. And so my big goal for folks is to understand a lot of these issues are preventable. Okay, getting in front of them. If you have an injury, instead of electing for surgery, take a look at something that's more conservative like regenerative medicine, and it might put you in a position where you can avoid that surgery altogether. We're getting more and more studies as well coming out even after these sort of surgeries are done. Maybe we can go in and heal up some of that damage that was done with surgeries. So that's another kind of leading thing that researchers are looking at. But when we're looking at, the pathology that we have on an image report, we have to take that with a grain of salt. So I want to bring up this study with you guys. This is a real good one in one of my favorite journals, surgical journal called Arthroscopy. Okay, this is back in, I think it was 2015 this came out. So follow along with me. Here's the title: Prevalence of Femoroacetabular Impingement, Imaging Findings in Asymptomatic Volunteers, a systematic review. So great study here. They had a couple of thousand people in this study, over 2,000 patients that had asymptomatic hips. So these are people that have no pain whatsoever. All right, and we're taking a look at them with some imaging. All right, and the purpose of this study was to look at what's the prevalence of people who have some things that are wrong with their anatomy on an image report that have no pain whatsoever. Because you might be thinking, well, if you have no pain, probably a good chance you have nothing wrong with that body part in terms of the imaging report. And this study actually showed quite the contrary. Okay, so we looked at this study, over 2,000 people. The actual mean sort of age of the participants in the study, pretty young, about 25 years old. So these are young folks that are in this sort of study. Okay, and can I just cut to the chase here? What they found: people with no pain whatsoever on their imaging report. Okay, they looked at labrum injuries. About 68% of people had injury to their labrum with no pain. Okay. Another one is we look at kind of the subtypes of something called femoral acetabular impingement, or FAI. Basically what this is they're just saying, hey, there's some sort of bony block there, that we've got some kind of defect that's there that's, causing a lack of range of motion and pain in a patient. So it's kind of the two main ones that we see. There's something called a CAM lesion, CAM, and also something called a pincer lesion. All right, so if we look at the ball and cup and how it fits together, sometimes if we have a big bony outgrowth on the cup side, we call that a pincer lesion. And if it's a big bony outgrowth on the ball side, we call that a CAM lesion. Okay, so when we're getting back to the study, again, over 2,000 patients, no pain whatsoever, they found CAM lesions in 37% of these patients. Okay, they found pincer lesions in 67% of these patients. So what does this really mean, right? We got a surgical journal, proper study, right? Thousands of patients. Really tough to do studies like this, by the way, getting people to sign up for imaging when they have no pain. And they found, a lot of these folks are having issues, with their hip joint. Okay, we've got things like CAM lesions and pincer lesions, labrum tears with no pain. All right. So when we have these sort of, readings on a pathology report, we got to take some pause before we start signing people up for surgery. If you're, having a labrum issue, yeah, certainly that's something that, surgery can address. But many times it is not the labrum that's causing symptoms. And here's a great piece of evidence showing that there's a lot of folks that have, a tear in their labrum or something going on there, and they have no pain whatsoever. So we have to be very, very careful, just relying on that imaging report. Okay, I don't want to say MRIs are completely worthless. I wouldn't say that. They can be certainly very useful. It's a piece of the puzzle that can help us get clued in terms of where your symptoms are coming from. But we don't want to solely rely on that because again, clinically we've been seeing this for years and years, and now we have really good evidence showing sort of prevalence of pathology with people who have no pain. Okay, and we can apply this sort of concept to many other areas of the body. In particular, this is one of those more common ones that we see. Because the numbers of these sort of clean out surgeries that are done continue to go up and up and up. And again, when we have this sort of evidence, someone's asking me, hey, should I have this surgery? I'd say, well, first of all, is this even causing your pain? Okay, very common that someone's going to text me or call me or email me, some images of their MRI or their X-ray or their CT, and they say, hey, is this something you can fix? And my first question is that even the cause of your symptoms? So remember, we cannot only look at the imaging results when we're putting, together that care plan. Very, very important that, we're certainly including that, in our pieces of the puzzle there. We got to make sure we're doing a good, proper, hands-on physical exam. Okay, that is not negotiable. That is absolute. We need to be putting hands on patients, doing a proper, in-depth physical exam. Okay, and now quickly, sometimes we can find that source of pain in the physical exam. Sometimes we can't do it, right? And the imaging can be something that helps, clue us in, because there's a lot of, just weird things that are out there in terms of diagnoses, right? But typically, common things are common, and we want to make sure that we're putting the patient in the best position that we can to be conservative, keep you out of that operating room, keep you off the chronic pain medications, keep you off of, the opioids, right? We all know how bad and addictive those can be. Keep you off of the non-steroidal anti-inflammatory drugs. We'll talk about that here later in the second segment. The steroid shots as well. So these are all things that are band-aids to whatever that sort of pain-generating tissue is. And what we'd rather do is just try to put some healing cells into that area, promote healing, promote that body part, remaining structurally intact, right? Get some more integrity to those tissues. Because remember, if we got pain in an area and a weight-bearing joint like the hip, chances are you're going to be very limited in what you're able to do in terms of exercise. Okay, you're squatting, lunging, walking, hiking, any sort of a sport where you're putting your foot on the ground and you're walking around, right? That hip is a very integral part of putting force in the ground and you having the ability to participate in that sort of activity. So very, very important that we're putting our patient in a position to keep that tissue intact and avoid those surgeries if we can. Okay, guys. So we're coming up here to the end here of our first half of our segment. I want to give you guys a chance too here to get some more callers in. Talk to me live in the studio. Again, we're talking all things orthopedic, sports medicine, musculoskeletal medicine. This is Living Pain Free. I'm Dr. Thomas Grove. That number to call live in the studio is 866-870-5752. That's 866 870-5752. And if you give us a shout for a limited time, we're going to send you a copy of our book absolutely free, even pay the postage for you. Title of that book is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Great title of that book. Great place to start to educate yourself on regenerative medicine. Again, if you have an ache or a pain and you're thinking, man, I really just don't want to have surgery. Maybe you already had a surgery, had a bad experience, and you just want to avoid that in the future. Check out Regenerative Medicine. Good place to start there with that book. Now, if you guys are ready for a free consultation over the phone with our staff, that number to call is going to be 800-300-9300. That's 800-300-9300. 9300, and check out our website. Spot on every page for you guys to get in touch with us while you're there. Check out videos of us doing the procedures. Check out some educational content. We're at www.stemcellinstitute.com. That's www.stemcellinstitute.com. It's the end of our first half of our segment. We're going to catch you guys after the break.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Stem Cell Institute in West Los Angeles. To schedule an appointment, call 800-300-9300. That's 800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment.